Hey, Vivalifers, it's Dr. Kelly, OMD. We are back for another week. Had a marvelous weekend, so I want to say thank you to everyone that watched, viewed, reviewed the Black Women Conquer Ovarian Cancer event that we had in Waldorf, Maryland. As you all know, that I am still here for my physician healthcare executive class. And one of the things we keep asking is, how are we going to change healthcare in America? I know there's big discussions about who should pay for healthcare, how should it be paid for, and all of that. But my thought is, what do you want your healthcare to look like? Because at this point in America, we have sick care, right? So you go to the hospital when you're sick, you go to the doctor when you're sick. Well, we want wellness, right? We want healthcare that focuses on prevention, and we want healthcare that focuses on wellness, so we don't have to be dependent on the hospitals and physicians when we're sick. If you have small colds and things like that, that's a different thing. But if you have an illness like diabetes or high blood pressure that leads to major complications like kidney disease and loss of eyesight, loss of limbs, as well as stroke and heart attacks, then that's not okay, because those are all preventable. Unless you were born with these diseases, which most people are not, they are preventable. And even if you are born with a chronic disease, you have ways that you can control them, but that has to be done in congruence or collaboration with your physician, your fitness leader, as well as your wellness coach. So that's what we're trying to do here, and that's what Vivalife is all about bringing you physicians, surgeons, nurses, fitness and wellness gurus, so that we can utilize wellness care versus sick care. And we don't have to be inpatients in the hospital. We don't have to undergo major surgeries or anything like that. All of these things that I'm recommending for you decreases the risk of cancer, decreases the risk of chronic disease. So, work with me. I'm here to help you. As far as formalized programs, I do not have one of those because I follow other people's. They have developed them. I do not believe in reinventing the wheel. But as far as motivating you and letting you know that your doctor, your America, the nation, the world's favorite OBGYN is here to help you do that through living your life. Viva life. Live life to the fullest, with joy and love and happiness and peace, and not having to worry, and living carefree, so that you can walk around, you can travel, you can do anything that you want, and you don't have to be worried about carrying a bag of medications or oxygen tank or anything like that. So that's the whole goal of Viva Life, so that we can live our best, our fullest life. Let's go. So that was my couple of minutes of what we're doing as far as healthcare or wellness care. Make sure you get your annual exams, your mammogram, your pap smear, your pelvic exam, get your prostate checked. Make sure they're checking your blood pressure, looking for getting your CBC, which is your blood levels done, your thyroid, based on evidence-based medicine. And if you want to know where that is, go to cdc.gov. So Center for Disease Control, cdc.gov, and they will let you know if you want to join the Vivalife Health Hub. I will submit lots of positive and evidence-based information for you, as well as all the things that we do to help you understand and be educated about your health. So let's go. So as you know, I've been working on these abs. This weekend was a fun weekend. I tend to take weekends off, but we can always get back to it. So I'm on a lightweight right now, so about 30 pounds. As you know, I love my arms, so that's one thing I focus on, even though I probably need to be focusing on my legs a little bit more, but we'll get to that. So this is just a really easy exercise, bicep curl, also working a little bit with my triceps and my shoulders. If you want to do more of a chest workout, pull back, lean back, put your back straight. Do the same thing, pull in at your chest. Make sure you're squeezing your back muscles when you do this, and breathe. Keeping your abdomen in. So you're kind of sucking in that abdomen so that you can stabilize your core. Good to go. You can do the same thing from the back side. You can see the muscles that we're working. And this is really all back for me. So do 3 sets of those, and of course I'm going to do my ab workout, so let me get my ball. This is my favorite. I don't do sit-ups. I told you I do crunches. I sit on the ball, make sure that my ball is in my backside. And depending on how strong your abs are, if you move a little bit further down on your back, it's going to be more of an intense workout if you're up here. And I really recommend this for my postpartum patients and my patients that have pelvic pain as well as prolapse, to utilize the ball at different areas in your back so that you make sure that you're supporting your back, not causing pain, but also isolating the pelvic muscles and your abdominal muscles, so that you can get a great workout. So I try to do about 100 of these a day. You don't have to do them at the same time. When I'm really intense in working on my abs, I do some formulation of abs, about 500 reps. But that's when I'm really intense. Alrighty, so I hope you have a wonderful day. Live